Welcome back, everyone. Today, we're diving deep into something we know you've been wondering about. High-dose thiamine for Parkinson's. Or, as some people know it, vitamin B1. We've been getting a lot of questions about it.
Yeah, there's definitely a lot of buzz out there.
Right. So, we're going to try to cut through the hype and get to the real info so these could actually help you. And for this deep dive, we're looking at this YouTube video from Parkinson's Disease Education.
Oh, I saw that one.
Yeah, and it's hosted by someone who actually has Parkinson's. So it's a really personal perspective.
It makes it so much more relatable, doesn't it? When it's coming from someone who's really living with it every day.
Yeah, exactly. It's not just some textbook explanation. They go through the history, the potential benefits, even how much to take. And they also look at what the research says, even what the Michael J. Fox Foundation has to say about it.
I'm curious about that. What's their take on it?
Well, we'll get to that. But first, let's back up a bit. This whole idea, it's not actually brand new.
Oh.
Yeah. It goes back to this Italian neurologist, Dr. Antonio Constantini.
Mm-hmm.
But it's being well championed now by Dr. Daphne Bryan.
Okay.
And she's a music psychologist. But here's the interesting part. She also has Parkinson's.
Wow. So she's not just researching it from afar?
Nope, she's living it, which adds this whole other layer to it, don't you think?
It totally does. I mean, it makes you wonder how that personal experience shapes her approach to the research.
Right.
And how she interprets the results.
Exactly. Now, before we get too deep into it, let's just do a super quick recap for anyone who might be new to all this. Parkinson's, it affects these brain cells called neurons, specifically the ones that produce dopamine.
Dopamine, that's crucial for movement, right?
Yep, it's like the messenger that helps control your movements.
Mhm.
And when those dopamine-producing neurons get damaged, well, that's where the tremors come from, the stiffness, all those classic Parkinson's symptoms.
And that's what makes this high-dose thiamine approach so interesting, because instead of just managing the symptoms, like with levodopa, which replaces the lost dopamine, this is about protecting those neurons, the ones that are still working,
Right.
and maybe even helping to repair the damaged ones.
So it's like a totally different way of thinking about treatment.
Exactly.
Okay, that makes a lot of sense.
Right.
And, it makes me think about what so many people with Parkinson's are really looking for. It's not just about symptom relief. It's about something that could slow it down.
Yeah.
Or maybe even reverse the progression, which brings us to the big question I'm sure our listeners are wondering. Can high-dose B1 do all that on its own?
That is the million-dollar question, isn't it?
It is.
And based on what we're seeing in this video, the answer seems to be maybe, but it's nuanced.
Okay, so tell me more about that.
Well, they say that in the very, very early stages of Parkinson's, it's possible that high-dose B1 alone might be enough.
Interesting.
But for most people, it's probably going to be most effective when it's used along with levodopa.
So it's not like a magic bullet,
Right.
but it could be a really powerful tool in the toolbox.
Exactly.
And one that could potentially help a lot of people. Because the video also talks about how high-dose B1 might help with, get this, both motor and non-motor symptoms.
Really? That's amazing.
I know. And she specifically calls out fatigue relief as being a big win, which, everyone gets tired sometimes. But with Parkinson's, it can be absolutely debilitating.
It can be so draining.
So imagine getting a real boost in your energy levels.
That would be huge.
Right. It can be life-changing.
Absolutely. It speaks to the bigger picture here. It's not just about managing those classic Parkinson's symptoms. It's about improving quality of life.
Yes. And in a really meaningful way.
Exactly.
Okay, so we've got this potential for neuroprotection, maybe even repair,
Mm.
and it could help with both motor and non-motor symptoms. Sounds pretty incredible, right?
It does.
But where does the research actually stand on all of this?
Well, that's where things get a little bit, more complicated, I guess. The video mentions that most of the studies that have been done on high-dose B1, they do show some promising results,
Okay, that's good.
but they haven't quite reached the level of being, definitive, like this works for everyone, guaranteed.
I see. And what about the Michael J. Fox Foundation? Because I know a lot of people look to them for guidance on new treatments and therapies.
Yeah, they're a really trusted source.
Right.
Well, their response has been, I would say, pretty cautious.
Okay.
They're basically saying that it might help, it probably won't hurt, but more research is needed.
The classic more research is needed.
Yeah, which I can understand why that might be frustrating for some people.
Oh, absolutely.
Yeah.
Especially when you're dealing with something like Parkinson's. Waiting for more research can feel like an eternity
It really can.
because you want answers now.
Right, you want solutions.
Exactly.
So it's a tough balance, wanting to embrace anything that could potentially help,
Yeah.
but also making sure we have solid evidence before making big decisions about treatment.
All right, it's a tough spot to be in.
Yeah,
It is a tough spot. So let's get practical for a minute, okay? The video talks a lot about dosage,
yeah.
and it sounds like that can vary a lot.
It can, and it kind of makes sense when you think about it. Everybody's different, and how we absorb and process nutrients, it can vary so much from person to person.
That's true. That's true. The video mentions a range, like from 200 milligrams all the way up to 4,000 milligrams daily.
Wow.
I know. It's a huge difference. But they really stress starting low and slowly increasing the dose.
Yeah, makes sense, like finding that sweet spot.
Right. Like finding what works for you.
Exactly.
And that's where, working with your doctor is so important.
Absolutely.
Especially if you're thinking about trying high-dose B1. They can help you figure out the right dose to start with and make adjustments based on, how you're doing.
It's all about that personalized approach.
It is. Okay, so let's say you've done all that. You've talked to your doctor, you started low, you gradually increased the dose. But you're not seeing any improvement. What then?
Well, that's where things can get a little, I guess, tricky.
Yeah.
There are a few reasons why someone might not respond to high-dose B1 therapy, even if they're doing everything right,
Right.
The video mentions a bunch of possibilities, like maybe moving through the doses too quickly, or sometimes people might not even notice the subtle improvements, or even like accidentally swallowing sublingual tablets, which are supposed to dissolve under your tongue.
Oh, right. Sublingual tablets, just to clarify for anyone who's not familiar, those are the ones that you put under your tongue, right?
Yeah, exactly.
And they get absorbed faster that way.
Exactly. So it's like little details like that can actually make a big difference.
They can.
And then there's also the whole thing with digestion and absorption. Like, if you're not absorbing the B1 properly, it doesn't matter how much you're taking.
Right, it's got to get into your system.
Exactly. And the video even mentions that nutrient imbalances could play a role, especially with magnesium and B-complex vitamins.
Oh, interesting. So it's not just as simple as popping a pill and hoping for the best.
Right, there's a lot more to it.
There are all these factors that can influence how your body responds.
Yeah, and that's why it's so important to have, like, open communication with your doctor.
Yes.
And be really proactive about monitoring how you're feeling, how you're responding.
It's a partnership.
It is. It's not just a one-way street.
I like that.
Yeah.
So after all this, where do we land on the should I try it question? Because I know that's what our listeners really wanting to know.
Right. The bottom line,
Yeah.
I think the video does a pretty good job of not giving a definitive yes or no answer.
Okay.
Because ultimately it comes down to a personal decision
Right.
made in consultation with your healthcare provider.
Which is probably the most responsible answer, right?
It is. It is.
But the video does seem to kind of lean towards exploring natural options like high-dose B1 before, jumping to new medications.
Yeah, they definitely emphasize that.
And I think that resonates with a lot of people,
Yeah.
who are looking for maybe a more holistic approach to managing their health.
It's about having more options.
It is. Okay, so we've covered a lot here. From the history of high-dose B1 therapy to the potential benefits, the research, the dosage, even some of the reasons why it might not work for everyone. But as always, there's more to the story. And this is where it gets really interesting, at least to me. What if the key to unlocking B1's true potential lies in understanding individual differences?
Ooh, that's a really fascinating thought.
Right.
It's like we've been looking at this puzzle from one angle, but maybe there's a whole other side that we haven't even considered.
Exactly. Everyone's gut health is different. Their nutrient levels are different. Even how they perceive those subtle changes can be totally different. What if those individual factors are playing a bigger role than we realize?
It makes you wonder, doesn't it?
It does.
Like, what if someone who's really in tune with their body is more likely to notice those small improvements, even if they wouldn't show up on a test?
Right. Or what if someone with a really healthy gut is able to absorb and use the B1 more effectively? Are we overlooking these individual nuances because we're so focused on finding a one-size-fits-all solution?
It's definitely something to think about, and it highlights the limitations of relying solely on those big studies that kind of treat everyone as this homogenous group.
Right.
It really makes you think.
It does. Like, what if the key to unlocking B1's full potential, it isn't just about the dosage, but about understanding those individual factors, addressing them?
I think that's such an important point. Like, we can have all this research, all this data, but if we're not taking the individual person into account, their unique needs, their circumstances, then are we really seeing the whole picture?
Right. And maybe that's why we see such mixed results with high-dose B1.
Yeah.
Some people, they swear by it. Others don't notice a difference at all. Maybe it's not just the B1 itself, but how it's interacting with each person's biology,
Yeah.
their own unique system.
That makes a lot of sense. It really speaks to the need for more personalized approaches to healthcare, not just for Parkinson's, but for everything.
Absolutely.
We're all so different. What works for one person might not work for another.
Yeah. So true. So where does that leave our listener? They're hearing about this potential treatment. Intrigued, but also understandably a little cautious.
Of course.
What would you say to them?
I think the first thing is talk to your doctor. They know your medical history. They can help you weigh those risks and benefits and really guide you in making that decision that's right for you.
Solid advice. And I'd add, don't be afraid to ask questions. Do your research, explore different perspectives, be an active participant in your own health journey.
Yes. Knowledge is power, right?
It is.
The more you understand about your condition
Yeah.
and those potential treatment options, the more empowered you are to make those informed decisions.
Love that. And remember, this is just the beginning of your deep dive. We've explored one specific approach to managing Parkinson's today, but there's so much more out there.
There is. New treatments are being developed all the time. New research is emerging. New stories of, well, hope and resilience are being shared every day.
So stay curious, stay informed, and most importantly, stay connected. There's a whole community out there, people with Parkinson's, caregivers, researchers, healthcare professionals, all working towards a brighter future.
And don't underestimate the power of your own mindset.
Ooh, that's good.
A positive attitude, a willingness to try new things. And that belief in your own ability to make a difference, it can really go a long way on this journey.
Beautifully said. Well, that brings us to the end of our deep dive on high-dose thiamine for Parkinson's. We hope you found this conversation informative and empowering.
And remember, the journey doesn't end here. Keep exploring, keep asking questions, and keep believing in the power of possibility.
Until next time, everyone, stay curious and stay well.